I wanted to give you a little bit of an overview. Oh, so last night I was assessing my stress level, and I decided that technology is what gives me the stress. I have no problem getting in front of people and talking, but I really worry about the PowerPoint and the cables. So I decided, you know what, I'm going to chuck the PowerPoint and I'm just going to talk, because that's what I really like. Yay! So I just wanted to give you some context of how I view the arts as a therapeutic tool in the community and why I feel that it's a very important public health tool that we have. We know from the field of psychoneuroimmunology, in which I spent many years working to build, that reducing stress and building social support actually improves our health and increases our resistance to disease. And I feel that the arts, used as a therapeutic tool, are particularly well suited to help us reduce our stress and build social support without the stigma of therapy. So we actually documented this in a study that we did a couple of years ago, where we developed a drumming program that integrated elements of counseling activities. We did this with elementary school students in a low-income area, and we actually found tremendous benefits for the students in a broad range of social emotional areas, ranging from total problem behaviors to anxious behavior, withdrawn depressed behavior, post-traumatic stress behavior, oppositional defiant behavior, attention deficit hyperactivity disorder, and sluggish cognitive tempo, which is a little bit of a proxy for attention. And I wanted to explain to you just very briefly about the study. The reason that we chose to do drumming. Why drumming? Well, one of the reasons is because it is very inclusive and very universal. It doesn't take any particular background to participate in it, as you discovered today. It is also something that is an integral part of many cultures. Some adult studies of drumming actually showed that drumming, combined with an element of reflection and self-disclosure, led to measurable reductions in stress. And finally, there was no stigma of therapy associated with drumming, so we figured it would be a good tool to use in an elementary school setting. So the other reason that we chose to use a low-income population was that in the scientific literature, we also know that low socioeconomic status is associated with increased levels of internalizing behavior problems in children. For example, the anxious, withdrawn, and post-traumatic stress type behavior problems, and also with externalizing behavior problems, which include such things as aggression and antisocial behavior and substance abusing behavior. So we felt that in order to have an impact, we should choose a group of people that was likely to need it. In the name of sustainability, we decided to challenge ourselves. We did not use a professional drum circle facilitator. We used the school counselor. We also did not choose to use small groups of children, 10 to 15. We chose to use the entire classroom. And for those of you who are involved in, biobehavioral or social research, you're more likely to get an effect if you use a smaller group of children that are identified as at risk or in specific need. And we chose not to do that. We chose to take a mixed bag of kids in a regular classroom. We chose to do it after lunch during the school day, which is a challenging time to teach. And we also chose to work with 5th graders in spring semester. So, okay, we know we have some teachers in the room. So we figured if we can get an effect under those circumstances, then it would increase our confidence in the strength of our intervention. And we, in fact, did. And we conclude that this kind of approach has tremendous public health value for several reasons. One is students express their stress in a wide variety of ways. So if we can find an intervention that actually addresses a wide range of problems, then this has public health value. Also, there's a decreasing access to health care, as we all know. And schools are a primary source of mental health support for children. So that makes this an important public health tool. The other thing is that there is an increasing societal healthcare burden from diseases associated with emotions and behavior. And I feel that the arts as a therapeutic tool can go a long way in starting to address that level of care, emotions and behavior that ends up triggering other problems down the line. So our next sustainability question was, can we train other people to do this? So we did it with the school counselor. It worked out great. We decided to, we arranged to teach an entire division of Los Angeles Unified School District mental health professionals. These were professionals working mostly with elementary youth in underperforming schools. And so we invited them all here. We had 86 participants, and we gave them a free 2-day training with the curriculum, and we measured their attitudes and their knowledge before and after. And what we found was very interesting. What we did was followed them for an entire year. I telephoned them a year later and asked them to what extent did they use drumming in their workplace within that calendar year, that academic year in which we taught them. And surprisingly, 30% of them had done some form of drumming. It ranged from the full-blown program with lap height drums and everything to using one drum. We gave each one a little frame drum, a little tiny one, in their counseling groups at school, and having the kids pass it around and share their story while they were playing something. And so I wanted to read to you a little something that someone told me on the phone about the benefits to the children. She said, I used the one drum I had to talk about the problems and have kids give information verbally and with rhythm on the drum. A lot of them would synchronize their words with the rhythm, which enabled them to at once have a show and also a useful experience. The kids loved it. Sometimes I had kids who were referred for acting out. Others were referred for withdrawn behavior and poor self-image. I would balance the groups to optimize them. I noticed improvements in behavior with a greater sense of cooperation between the children. Working in groups with music can be helpful with kids because the children who were shy or acting out would bring each other's qualities out in one another to level each other out. Some of these children, if put together previously, would have been fighting. Then they became a group, and you don't beat up a member of your group. I really appreciated the training. So I thought that was fascinating. So with little resources, just one little drum, she was actually able to see a noticeable benefit in the students that she was serving. Some other information that we found was predictors of implementation. How could we predict who of the 86 people would actually go and use it in the field? And we noticed some correlations statistically. One was satisfaction with the training program. Another was a sense of preparedness for the program delivery. And another was the degree of perceived barriers to implementation, like space or teacher support, for example. But the strongest predictors were very interesting. One of them was confidence in the ability to implement at the outset, even before the training. So there's a type of person that actually is inclined already, even before you train them, but especially their commitment to it increased after the training. And the other one was interest in drumming aspect of the training program at the end of the training. And I'm sharing this with you because if you're out in the field trying to train people and trying to figure out who's likely to carry out the mission, that there are simple ways, in simple survey methods, of finding out who is most likely to deliver, and then you can use that as a basis in the future for deciding who you want to invest a little more energy in developing because you know they're more likely to participate. I also found out from non-implementers that many of them really wanted to, in the future, implement the program. And so they automatically, even if they didn't implement the program, they become advocates of the use of the arts as a therapeutic tool. So in addition to actually delivering services to children, we've now developed a larger group of advocates for this kind of work. Diffusion of innovations theory, which is often talked about in public health, actually states that information received from near peers is more likely to lead to adoption of new behaviors or ideas than information from other sources. So in other words, what your friend tells you is probably going to carry more weight than what a scientific paper even tells you. So that's information as well. So with each person that gets the message, they spread the message on to others, and in this way, the message grows. The other thing about the use of the arts as a therapeutic tool that is so important is that it expands possibilities for healthcare beyond its current definitions, because these methods are so easy to implement in schools, in healthcare settings, and in recreational settings and other settings. So all of a sudden, it creates the possibility for a public health safety net, which I think is very important, especially at this time in our society with the limitations in healthcare that we have. So we've now gone on. Our next step in this process is that we are actually working with Quincy Jones Elementary School in South Central Los Angeles to observe how teachers, what kind of experience teachers have trying to deliver this. We have trained a lot of their teachers there. We're going to watch what organically happens. We're going to see what kind of help they need, what kind of, how they adapt the program to the different age groups that they've got, and the extent to which they actually implement after training. So this is a lab experiment, and we're actually going to be also measuring outcomes for the children as well. We're actually looking for simpler ways to measure outcomes so that in the future, those of you who want to do a study don't have to use the extraordinarily lengthy version of the survey that we did for our previous study, and that there will be shorter methods. We also have trained College of the Canyon students. Do we have some here today? I think we do, maybe? Yes, a couple here. We trained 60 of them a couple weekends ago in how to deliver a one-session demo to all 6th graders in Santa Clarita Valley. That's 5 school districts. And what we have found so far is that all students, according to the person who coordinates the TEACH program that is in charge of the students, that to every single student is energized and excited by it. And Mike Domeno, my partner, has been out there and said that it's working beautifully from what he can tell. So we're really pleased that college students now become a potential source of delivery. I also had the chance this summer to observe the Kaiser Permanente theater, educational theater staff deliver their adaptation of the program to middle schoolers in underserved areas. And I was blown away with how creatively they did it. And that made me realize that performing artists are also great potential deliverers of this program. Is Jerry here yet? Jerry Farrell? Okay, she's the head of that program, and she's going to be coming later. We've also begun observing what happens in the Boys and Girls Clubs. We have actually trained some of their staff to deliver this program. We have yet to actually see how it's going to come out because they've had some staff turnover. But we have noticed that their staff are tremendously enthusiastic and playful, very comfortable dealing with large numbers of children. And currently, we are training the staff. I'd like to introduce Kathy Cass there. Raise your hand. Kathy is actually one of my, as a board-certified movement therapist, among other things. And she is actually on my team of people to develop movement, rhythmic and theater-based activities and strategies to promote meaningful engagement and cooperation at all times of day at the Boys and Girls Club, even during transitions. So it's a tall order, but we're doing it. We're training the staff, and again, it's about sustainability and how can we build a sustainable program so that organizations that we serve don't have to hire specialists in order to have these programs. Our general goal for UCLA Arts and Healing is to not only promote sustainability and as much as possible evidence-based work, but to work with national organizations for broader health, public health impact. And in a nutshell, our overall findings with all the different groups that we've tried to train is that everyone brings their special gifts to the table, and so far it's all good. So that's it. I thank you very much.